Good day, ma'am. I am Kit OBL Analyst, a student nurse from PSN 1, Section 2. And today I'm going to demonstrate the range of motion. It is a movement of the joint to its full range and in all appropriate planes. There are three main purposes: the maintenance of current joint functions, restoration of joint functions that has been lost through disease, injury, and lack of use. And this is also to strengthen the muscles. There are also contradictions, and clients with heart and respiratory disease in range of motion increase the demand of circulation. And then the range of motion should not be performed if a joint is swollen, inflamed, and if there's an injury in the musculoskeletal system in the vicinity of the joint. And the equipments needed are the BP apparatus, the stethoscope, the thermometer, and pen and paper for recording. And I will first do the range of motion before doing the procedure with the client. And now, we'll start with the neck. Position your head as if looking at the toes. This is flexion. And position your head as if looking straight ahead. This is extension. For the hyperextension, position head as if looking at the ceiling. Lateral flexion, move your head towards the left side of your shoulder and to the other side. And then for the lateral rotation, move your head in twisting movement from side to side. Now let's proceed with the shoulders. Flexion, move your arm forward and overhead. And extension, return your arms towards the side of your body. For abduction, swing your arm up and return. And for the adduction, return your arm towards the side of the body. And for the internal rotation, swing your arm up and across the body. And for the external rotation, rotate your hand and back. For the elbow, cup your elbow and bend the arm. This is flexion. And for the extension, straighten the arm. The wrist. Flexion. Straighten your wrist forward. Extension. Straighten the wrist. For radial deviation, bend the wrist towards the thumb. And for ulnar deviation, bend the wrist towards the little finger. And circumduction, move the wrist in circular motion. For fingers and thumbs, flexion, bend the fingers and thumb onto the palm. And extension, return them to the original position. Abduction, spread the fingers. Adduction, return the fingers to closed position. Like that. And for the circumduction, move the thumb in circular motion like this. And for the opposition, touch the end of the thumb of each fingers in turn. Now for the hip and knee. In flexion, lift the leg, bending the knee as far as possible towards the client's head. Flexion, return the leg to the surface. Abduction, move leg outward towards the head of the bed. And abduction, bring leg back to the mid-leg. The internal rotation, roll entire leg inward. And for the external rotation, roll entire leg outward. For the ankle, cup heel and bend the ankle towards the body. And for the plantar flexion, you need to cup heel and push ankle downward to point toes. And the circumduction, rotate the foot in the ankle and in another direction. Toes, flexion, bend the toes forward. Extension, bend toes up. And abduction, spread the toes. And for the adduction, return the toes. Like that, in the closed position. So now, let's do the procedure with the client. But first, we need to do an assessment first. You need to assess the client's joint mobility and the activity status. Assess the client's general health status and assess the client's ability to participate. And then, consult the physician on the medical diagnosis of the patient so that we can determine the if range of motion is appropriate or contraindicated on the medical condition of the client. So now, in this case, we will not conduct the exercise on the neck because the patient had a surgery at the back of his neck. So now, for planning, plan the time of exercise. You can do it once or twice a day or as prescribed. Plan the type of exercise. There are 3 types of exercises: the passive, active, and active associative range of motion. It depends on the client's condition. That's why we need to assess the client first. Next is gather the equipments needed for checking the vital signs. And then wash hands to prevent possible transfer of infectious organisms to the client. So now for the implementation, let's proceed. We need to identify the client first. So, good morning, sir. I am Kit Aubrey L. Angeles, your student nurse for today. I need to confirm some of your information. That's why I'm going to ask you to please state your name.
I'm Kit Angeles.
Okay, I will perform the range of motion exercise from your shoulders to toes. This is to help you heal and to preserve your muscle tone and joint flexibility. Is that alright with you?
Okay, ma'am.
Okay, I've already washed my hands before going here, and I will close the curtains to provide you with privacy and avoid distraction. And always make sure that your patient is comfortable and in supine position to avoid strains. And take vital signs initially and in between the process. This is to have a baseline basis and to monitor the unjustified alterations of vitals that can hinder the progress. So now, let's proceed. Let's proceed with the shoulders. Okay. Flexion, extension. Abduction, adduction, abduction, adduction. Internal rotation, external rotation, internal rotation, external rotation. Now, for the elbow, flexion, extension, flexion, extension. Now, for the wrist, flexion, extension, the radial deviation, ulnar deviation, radial deviation, ulnar deviation, and the circumduction. And for the fingers, flexion, extension, flexion, extension, abduction, adduction, abduction, abduction. And now, the circumduction of the thumb. And opposition. Now, let's proceed with the hip and knee. Now, flexion, extension, flexion, extension. Now, abduction, adduction, abduction, adduction, internal rotation, external rotation, internal rotation, external rotation. Now for the ankle. Dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, and circumduction. And for the fingers, the toes rather, flexion, extension, flexion, extension, abduction, adduction, abduction, adduction. Now, let's proceed with the left side of the patient. Okay? For the shoulders, flexion, extension, flexion, extension, abduction, adduction. And then, internal rotation, external rotation. And then, for the elbow, flexion, extension, flexion, extension. And then for the wrist, flexion, flexion, extension, flexion, extension. For radial deviation, ulnar deviation, radial deviation, ulnar deviation, and the circumduction. And for the fingers, flexion, extension, flexion, extension, abduction, adduction, abduction, adduction. The circumduction of the thumb, and opposition. Now, let's proceed with the hip and knee. Okay. So, flexion, extension, flexion, extension. Now, abduction, adduction, abduction, adduction. Internal rotation, external rotation. Now, let's proceed with the ankle. Dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, and the circumduction. And then for the fingers, flexion, extension, abduction, adduction. And now, make sure that your patient is comfortable and wash hands after the exercises. And for the evaluation, evaluate the patient's if the patient is experiencing fatigue, joint discomfort, and joint mobility. For the documentation, document the type of exercise that you conducted with your patient and the patient's response. And that's all for the range of motion exercises. Thank you.